Minister, in all of the discussions on budget 2023 and 2024, as you know, I pointed out very robustly that the health service was not getting the funding it needed to stand still, and that we were running very significant deficits, and that at some point a cheque would have to be written to cover that deficit. There was very serious pushback from not necessarily you, but from government, from the Minister for Public Expenditure and Reform, the Minister for Finance, indeed the Taoiseach as well, when these issues were raised with them. Only for, in the summer of this year, 1.5 billion was made available and had to be made available to fill that big hole that was in the HSE's finances because of reckless funding of the health service for 2 years. But that wasn't without its consequences. That resulted in a recruitment embargo that was put in place in 2023. That recruitment embargo was put in place by the head of the HSE. Minister, I didn't interrupt you, and I have my time, and you can dispute what I'm saying, but it's indisputable. The head of the HSE, because of what he said was a need to contain costs, sent communications to the health service that he was putting in place a recruitment embargo with very limited exceptions, as we know, in relation to final year nurses and hospital consultants, but across a whole range of other grades. We had a recruitment embargo. You will also know, Minister, that the Irish Nurses and Midwives Organisation have said that because of posts that were vacant at the end of 2023, on the 31st of December, they say 2,000 nursing posts that were vacant, they're now vanished and gone. We're hearing the same across a whole range of other grades as well. When you talked about radiation therapists, we heard from SIB2 last week when they told us that there's a 30% shortage in these grades. That's been the case for some time. There's equipment in cardiac services that are not being properly utilised because they don't have the staff. So when we talk about inefficiencies in healthcare, here is one inefficiency where we can't and we're not recruiting the staff needed to make best use of very expensive equipment that exists in the healthcare system because of either an embargo on the one hand or very limited curtailed recruitment on the other. And I'll get to what you have said, Minister, about additional staff that has come into the health service in a moment. But the Irish Cardiac Society were before the Health Committee today, Minister, and they said that there were significant workforce issues, including an embargo on filling vacant positions since October 2023. They gave one recent example where novel services to manage patients in the community were suspended or partially suspended because of the embargo. They also gave examples where cardiac physiologist posts are about only at 2/3 of where they were 4 years ago. And again, there's vacancies in these posts up and down the state in hospitals. And again, they made the point that we have cardiac equipment that is not being properly utilised because we don't have the staff. And they specifically mentioned the recruitment embargo, but also a suppression of posts. So it strikes me that we have the Cardiac Society, the Irish Nurses and Midwives Organisation, SIB2, FORSA, who will be in before the Oireachtas Committee today, frontline healthcare staff who want to come and work in the public system, all telling us that there is a problem with recruitment, all telling us that the embargo was wrong, all telling us that the consequences of this, including in community services, where we know it's really important that we have the staff, and yet the only person who doesn't accept any of that is the Minister for Health, who keeps talking about all of the additional staff that have been recruited. There has been additional staff recruited. I recognise that. Nobody is disputing the fact that the health service has not grown. But what you can't dispute is that there was an embargo put in place that did cause reputational damage, in my view, to the HSE. There was thousands of posts that were suppressed, and there are posts that are needed to fund the healthcare system and to equip the healthcare system to deal with the increased demand that is there. Today, Minister, I got a parliamentary question back from you on agency spend. 650 million on agency spend in 2023, up from 300 million in 2019. Up to the end of August this year, 470 million. Despite all of your talk about productivity and savings task forces, and we're going to save money and clamp down on waste, last year 650 million on agency spend. Over 150 million of that was on nursing. And people look at that and say, we're spending hundreds of millions on agency spending. It's going up and up every year. And yet we have nursing posts that were scrapped, vanished, gone. And yet we have this increase in agency spend. That's inefficient. That's your responsibility. You have to accept your responsibility for that. So I accept all of the recommendations and the proposals which are in this private member's motion by the Labour Party. Thank you.